All right, so the light's solid, which means the Doctors in Live with TOA is back. It's Friday. Gray Stahlman, your host. This young man here is Chase Korn. I'm really looking forward to this episode. Dr. Korn is a foot and ankle specialist, and he'll tell you more about himself. But we're going to be talking about ankle replacement, something I've never seen, I've heard about, exciting technology, and should be a good deal.
Well, not often do I get to teach you something you don't know. I've been looking forward to this.
Well done, Yoda.
Young
Sim. That's right. Young Padawan. Thank you. Anyway, so as every Friday, or almost every Friday, Facebook Live is here for you. TOA is the largest, oldest musculoskeletal-based practice in the mid-state. We span from Knoxville now to Columbia, all the way up into Kentucky, and then down to Spring Hill. Hard to believe. Anyway, go to TOA.com if you need anything from us with regard to information, where we are, what our services are at our various offices, about our physicians. TOA.com is a good resource. The Media Center on TOA.com has all of our video content that we've done before, informational videos, little tips videos, all of the Facebook Live videos are there. It can be a good resource for people. I actually just got a story today, Dr. Garside, who we talked with a number of months ago about meniscal tears. His patient came in with a meniscus tear, and she went online and saw our video and learned about meniscal tears. And they're going to do surgery, and she had no questions because he answered all our questions on that video. So it was pretty cool. Anyway, TOA.com, you can actually even make an appointment online. As always, we are both fellowship-trained orthopedic surgeons, but we're not your orthopedic surgeons today. We're just here for information, education, little entertainment. And so if you have a true musculoskeletal problem, go to an expert. TOA.com can help you with that. Anyway, without further ado, Chase Korn. How long have you been with us?
8 years.
8 years.
This fall.
Yeah, unbelievable.
Yeah.
Super guy, great doctor, great surgeon. Foot and ankle is your specialty. Where do you practice?
Primarily at St. Thomas West, right down the road, but I have office in Franklin and Dixon and Cookville.
Awesome. So you're all over the place.
All over the place.
Wow, awesome. So think about that. He's in Cookville. I mean, that's 2 hours away.
Almost,
yeah. And Dixon, that's another hour away.
It's close to another hour away.
Holy smokes. Okay, good for you. That's
Yeah.
awesome. Anyway, so we're going to talk about ankle replacements.
Yes.
Okay, so we've had 2 episodes, one on knee replacements, one on hip replacements, big joints. The ankle has kind of been a holy grail kind of thing, at least in my tenure as an orthopedic surgeon, because when I was in training, we never had any good answer for an arthritic joint in the ankle other than fusing the ankle joint, right?
Right.
So this is technology that's been around now for how long, you think?
Well, I mean, ankle replacements they've been done since the 70s, but the first attempts at ankle replacements, the components were very crude, and people didn't really know what they were doing very well. So the results were dismal, and it was nearly abandoned for a period of time. And then fortunately, over time, we've developed techniques and better implants and better understanding of the joints, and it's really built and grown in popularity, and the results have really started to pick up with hip and knee replacement.
Cool. So who's a good candidate for an ankle replacement? What are you looking for when a patient comes in to see you? What kind of problems are they complaining about and whatnot? And then also, what might keep somebody from being a good candidate?
Yeah, so that's a great question. And I think, honestly, your success rate with ankle replacement is primarily due to your patient selection. So I think patient selection is absolutely critical. So ankle replacement, what we're looking for is, number one, that you have reasonable range of motion in your ankle. So if your ankle is totally locked in, that patient's probably not going to do great with a replacement, and that patient needs a fusion. But if they've got reasonable range of motion, they've got reasonable stability in the joint, patients not too heavy, patients, we worry about patients with neuropathy, worry about smokers, we're going to be really cautious in those patients. But if you've got a good stable ankle joint and good range of motion, you're a good candidate for an ankle replacement.
Is there an age restriction?
There's not a restriction, but obviously we like patients to get a little bit older for replacement, primarily because it's not going to last forever. So if I get somebody at 65, that's kind of the magic number I'm looking for.
Okay. Okay. Well, that's a good segue, because I wanted to ask you about how long do these things last?
Yes.
And what is the fallback plan if you have somebody who has an ankle replacement that is going bad?
Yeah, so that's a great question. We talked a little bit about this. So the best data we have right now is ankle replacements at 10 years, about 90% success rate. We think that translates to about, we're hoping 15 good years out of an ankle replacement. So that's kind of the number that we always look at. Now that said, that's old data, and the implants we're using now are much better than the ones that were studied in that particular study. So we think that will translate into better durability and longer lifespan of the replacement. But we kind of think about 15 years.
Yeah, and that's where, for some perspective from the old guy, that's kind of where we were when I was in training.
Yeah.
Was 15 years, 10 to 15 years for a hip and knee replacement.
Right.
And then we were looking at older implants, older data. As technologies improved, as new implants came along, as techniques improved,
Right.
we got better data with the more modern implants, and we actually have a much greater span of life.
Absolutely.
It's just been the fact that we haven't had these high-tech implants for that long.
Correct.
Is that right?
That's
Yeah,
exactly
we just don't
right.
have this. So we don't know. This implant right now that you're using could last 25 years.
I would love if it lasts 25
We
years.
just don't know yet. We don't have that
Exactly.
experience.
And then you get, you also get to a point where if you can get a patient to, let's say, 80 years of age, if you can get them to that point, they're going to be pretty happy with that too. So if you got someone who's 65, do you need it to last 35 years? Well, not necessarily.
Right.
So if you can get 20 years would be a great result.
Awesome.
Yeah.
Okay, so tell me a little bit about how you do an ankle replacement.
Yeah, so it's pretty straightforward. So it's a direct anterior approach. So I brought this model here. This is the ankle, and this is obviously the outside. This is the fibula. This is the outside of the ankle. This is the inside here. So we use a direct anterior approach. So we go straight from the front. It's about a 12 centimeter incision, and through that we can get straight down to the ankle joint. So this one already has the replacement in place, obviously, but through that incision, we actually use, based off of their CT scan, patient-specific guides that fit perfectly on the bone to help guide our bony cuts. So once those are in place, we make our cuts, and then through that we implant the metallic parts into the ankle, and this little piece of plastic here which helps those parts move smoothly. But it's about a 60-minute operation. It's very easy to do with this patient-specific instrumentation that's been developed for this.
Now, do people have to stay in the hospital? Can they go home the same day? Depends.
Like all joints, we are moving toward more outpatient joints. Typical patient, if they're a little older, have some medical issues, they'll typically stay in the hospital overnight and go home the next day.
Okay.
Yeah.
Okay. And then what's the recovery rehab type of protocol after surgery?
Yeah, so ideally, the nice thing about ankle replacements versus a fusion is we want them walking on it right away. But the rate limiting factor for ankle replacement is the wound. So the wound has to be healed properly before I let them start walking on it. But ideally, at 2 weeks, the stitches come out and they're in a boot and they're walking on it at 2 weeks.
Awesome. And then when do you kind of tell people, Doc, when they ask you, Doc, when am I going to be as good as I'm going to be and able to do what I want to do?
Yeah, well, I'll tell you, most folks who have ankle replacement, they're better than they were before surgery at 4 to 6 weeks.
Right.
So they are happy immediately. But I tell them, my goal is no restrictions, full activity at about 2 months.
Wow.
Yeah,
Wow. So when you say no restrictions, are you really meaning no restrictions?
Well, yeah. So that's let me comment on that a little bit. So I tell folks with an ankle replacement, it's like getting a new set of tires on the car, right? So the harder you go, the faster you go, the faster you're going to wear out that replacement. So if someone comes to me and says, my goal is to run a marathon in next year, I'm going to say no ankle replacement for you. So I try to have them avoid high impact activities as much as possible. Okay. But anything low impact, you like to ride a bike?
Yep.
So bike's great. Yep. Anything low impact is fair.
Golf, bike.
Golf.
How about things like tennis, pickleball?
Absolutely.
So kind of short, quicker things.
Absolutely, yes.
Awesome.
Yeah.
What are, as with any surgery, there's risk.
Of course.
What are the risks? So we've talked about risk a bunch of times on this show. The big ones: infection, wound healing problems, some sort of complication with the hardware. what kind of specifically to ankle replacements do you have to talk about to make sure people understand?
So I think it's a really important conversation to set expectations and to have that. I mean, I think surgically, obviously, the immediate post-op period, we always worry about the wound. Most of the time, that's a very minor wound healing issue that's dealt with superficial dressing changes and things of that nature. Risk of a major infection is about 1%, so it's very uncommon with ankle replacements. Once we get past the initial post-op period, then we start worrying about mechanical stuff. So we're worrying about the loosening of the components. You can get stress fractures around the components. You can get cysts that form, things like that. And we keep a close eye on that. So I see patients every year after an ankle replacement because we want to get ahead of those things if they happen. We can catch them, deal with them before they become a real problem.
So if an ankle replacement, now you probably haven't had many of your ankle replacements come back for revision, right? It's been a little early.
Fortunately, to date, I've not revised.
Good.
Yeah.
So say, for example, you're seeing an ankle replacement and it's used up its lifespan.
Right.
Can you re-replace an ankle replacement?
You can, absolutely. You can do a revision replacement. And fortunately, the systems for revision has really exploded over the last 5 years because as now ankles are being done more and more, obviously there are people that are getting to the end of the lifespan of the replacement. So we've had to develop techniques and different implants to deal with that. But the technology has improved drastically over the last 5 years. So we have really good tools and techniques to deal with revision replacement and replacing bone loss and defects and things like that. That said, if a patient's in a situation where they're really not able to have a revision, there's just not enough real estate to work with, we always have a bailout of converting that patient to a fusion. So you just take out the loose components, put a cadaver bone or bone graft in there, and fuse all the parts together. So we do have a bailout option.
So I'm sure this is a common question for people. Can you walk with a fusion?
Absolutely. Absolutely.
Yeah. I mean, your ankle doesn't move.
Ankle does not move.
But you actually have some mobility in the backside of your heel.
Right? A lot of patients who are having a fusion, they've worn a rigid brace of some sort at one point, and we tell them that's pretty much what you would expect your gait to be like, how it feels when you're wearing that particular type of brace. So
and those people just don't have the pain. I mean, that's the big deal. They may have a altered gait, but the pain is really so much different that their function is better.
If you can take away their pain, they learn to deal with the differences in the dynamics
that
of
makes sense.
their gait.
I mean, it sounds really drastic, but actually, functionally, fusion of the ankle works pretty well.
Yeah, it's been around for a long time, and people do okay. Yeah.
So, what other thoughts do you have? Out there selling an ankle fusion. Educating people on ankle fusions. What do they need to look for? Who would, what would you say would promote somebody to seek out your help?
Yeah, well, a lot of people that come to see me for ankle replacement, a lot of them have seen other doctors and have talked about fusion. And so a lot of cases, they're already aware of the fusion. They know what that option looks like. They've talked to people about it. And so a lot of times they are looking for an opinion about, what are the main differences in fusion and replacement. And, one good example is a lot of patients, these are mostly post-traumatic arthritis patients. Some of these patients have had a fusion, maybe on the other side. And that's an ideal situation for an ankle replacement because people can tolerate a fusion on one side pretty well. You go and fuse both ankles,
that's a
different story. So that's one example where people will truly seek out an ankle replacement. But I tell folks in general, particularly given if they're an appropriate age and they're an appropriate candidate, we know that the function is going to be better if you have an ankle replacement versus a fusion. The other thing that we see with fusion that people are concerned about is you fuse a joint, over time, excess stress on the adjacent joints, you're going to start getting arthritis in other joints. So there is some downstream effect of having an ankle fusion, aside from the differences in your gait.
Yeah, and we've talked about that regarding the spine fusions in the past. We have the exact same problem of you still wear out the parts that are still moving. Yeah.
Exactly. Yeah. And you get to a point, you fuse the ankle, you can't take it back. The downstream effects, you move to the next level, stiffen it even more, then you're going to the next level, and so on and so forth. So,
does everybody who deal with foot and ankle problems, are they capable, qualified to do an ankle replacement?
I would say they're capable. Whether they're qualified, it really comes down to a comfort level and a training. Their training background. I was fortunate enough to train in a fellowship that was a high volume referral center for total ankles. So, fortunately for me, coming out of fellowship, I was very comfortable with ankle replacement. Right away. There are certainly surgeons who did not train on ankle replacements in their fellowship who still learned the technique. They went to training with the company and do ankle replacements. There are certainly surgeons who did not do ankle replacements in fellowship who've decided not to do ankle replacements in their practice. They just didn't feel comfortable with it and decided that was not going to be part of their practice. So it's kind of all over the board. But
how about the world of podiatry? I know I'm stepping in a minefield a little bit.
Yeah, that's a big one. Yeah.
There are a lot of podiatrists out there,
Yes.
and a lot of people go to podiatrists. Are podiatrists in a position to be doing ankle replacements?
There absolutely are podiatrists that do ankle replacements, and again, I think it all comes back to their training background. So it really depends on, we've seen in podiatry a lot of variability in their surgical training, where they train, what exposure they had. Some prefer to do mostly midfoot, forefoot. Some who do more hindfoot, complex reconstructions, ankle replacements, all those types of things. So I think it really comes back to their training and their comfort level.
Yeah, and my philosophy has always been, if you do it a lot, I think you're better at it.
Yeah.
The more experience you have, the cleverer you can be in the operating room when you're faced with a challenging situation. You have more tools in your toolbox.
Sure.
So I personally, and I suspect you would too, when you're doing your search for information about something like ankle replacement or any other kind of musculoskeletal care, think about looking at those people who have lots of experience in whatever you're dealing with, and get more than one opinion.
Absolutely. I think that's, and I have some other physicians in town who we will routinely refer patients back and forth for second and third opinions, because these are big decisions for patients to make, and they want to feel comfortable with the decision they're making, and they want to feel comfortable with their doctor. So I think having a couple of conversations is always appropriate, and just to getting to that point where they feel ready to do it, and I feel like they've made a thoughtful decision.
Yeah. I think the fear of people feeling like they're being pushed into something is always real, and nobody's died from arthritis.
Correct.
Okay.
Correct.
It's not a life-threatening problem.
Correct.
What do you see the future of ankle replacements?
Oh, it's just going to keep growing. I mean, I think we've reached a point now where the instrumentation, the technology, the implants, I mean, they are functioning on the same level as hip and knee replacements for the most part. So from a technology standpoint, I think most of the design and research moving forward will deal more in the revision type systems. How do we deal with the failed total ankle, or the ankle that's just, again, as you mentioned, sort of lived its lifespan. So I think that sort of is the horizon. And then I do think there will be, we still have to think about some additional salvage options. When a total ankle goes bad, and maybe we can't do a revision ankle, but that patient's not, ready to have a massive, fusion type of procedure. So I think there will probably be some technology that we develop over time to address that situation.
Cool. What else do we need to know about ankle replacements?
Not much. I think the thing that's really strikes me over the last few years is I think the awareness of ankle replacement is really starting to grow through communities. It was amazing to me 3-5 years ago how many patients would come in, especially from some of these outlying communities, and had never heard of an ankle replacement. They didn't even know that was an option for them. But I think through the internet and all the social media stuff, and people the awareness is growing. So I think you're going to see a continued sort of explosion in the number of ankle replacements that are being done, and particularly as the success rates continue to improve. And this is a proven operation at this point, and it has a track record, and it's going to just continue getting better. So patients are going to start seeking this out more frequently.
And last question, because everybody has this on their mind. At this point, ankle replacements are not investigational, they're not experimental, they are paid for by insurance. Is that correct?
Absolutely,
okay.
Absolutely.
Okay,
yeah.
good.
It is a proven technology at this point.
Yeah. And so, I mean, it's really, it's a very cool technology. Having had a hip replacement, I know the life-changing effect that a joint replacement can have on daily function and comfort and well-being. And, like I said, when I trained 30 years ago, there was no such thing as an ankle replacement of any use, of any value. Right. And it really is a testament to modern technology, science, material science, and clever physicians thinking up new ideas to try to get things to not only work but work well and make it easier to be available for everybody.
Yeah, no, I think you're right, and as you touched on it, I think one of the things that's really stuck with me with ankle replacement is, a lot of us went into orthopedics because we saw the immediate impact on the patient's life. And of all the procedures that I do, this is one of my favorite operations for that very reason. These patients have relief almost immediately, and you can see the difference in their quality of life almost immediately. And they're, for the most part, these are very happy, very grateful patients, and it adds to your job satisfaction quite a bit when you get to deal with these patients.
Right, that's awesome. I totally get it. That's why total joint surgeons tend to be quite happy.
Right.
Because their patients are typically very happy.
Absolutely, yeah, that's right.
Well, Chase, thanks so much for being here.
Thanks for
appreciate
having me.
it.
Yeah.
If you please come back, let's find another time to chat. We can talk about anything you'd like. There's a lot of interest online about various foot and ankle problems because it is such a common situation.
We do walk on our feet.
Yeah, we do. And
Yeah,
as I say, we've got hands and dumb hands, but the dumb hands do all the work. But in any event, that'll be it for today. Again, go to TOA.com for all your musculoskeletal information needs. We are here to try to help you get more functional and enjoy life more. A couple of cleanup items. We're going to be out for a couple of weeks, various travel and stuff like that. So I think the next time we come back, remember I mentioned last week a little teaser about a topic, and I sent you on a homework assignment. If you have not seen it or heard it, look up on Peacock for the video or on Wondry, W-O-N-D-R-Y, which is a podcast producer. Look up Dr. Death. We're going to talk a little bit about Dr. Death and the impact, what it really means. Because it's a profound, extreme situation, but it actually has pertinent relevance to my practice and spine care in general. So I hope you'll come. We'll talk a little bit about it from my perspective being a spine surgeon here in Nashville.
Did you watch the show? And did you do the podcast and the TV show?
I've only watched a couple of his TV shows.
Yeah.
I did enjoy the TV show that was the real people that did it, and it just watch it. Or the podcast is awesome.
And the podcast,
and just remember that's an extreme. Okay,
Yes.
It's not the norm. Secondly, this week the Pfizer vaccination was formally FDA approved. So the people out there who have been hesitant to get a vaccination because it was for emergency use only, go get vaccinated. It's safe, it works, it's going to keep people from dying. A little anecdote, talking to a friend of mine last week in the hospital, of 18 patients in the ICU, that all of them had COVID, 16 were not vaccinated, 17 of them were expected to die. That's a big number. So get your vaccination, okay? And then lastly, I saw a patient today who I've cared for a very long period of time. She lives in Waverly. She and her husband lost everything in the flood. Everything. No flood insurance, nothing. They don't have anything. So if you can do anything for the folks in Waverly, McEwen, Humphreys County, what they really need is our love and support and money. Don't send them toilet paper. Don't send them bottled water. They need money to help rebuild their lives. So go to the legitimate charities around that are undoubtedly there or being set up to help our friends and neighbors out. Okay? Tragic, but the volunteer state takes care of our own. So that's my personal thing. Anyway, so that's my soapbox. We'll see you in a couple of weeks. Again, Chase, thanks, man.
Thanks for having me. Enjoyed it.
All right, have a great weekend.
Adios.